Dr. Dunn. I'm a surgeon who specializes in the esophagus and stomach in the San Francisco Bay Area. Do you ever get a burning sensation below your chest right after eating? That might be acid reflux, also known as GERD. It's when the acid from your stomach flows back up into your esophagus. That's the tube that goes from your mouth to your stomach. Today, we're going to talk about some of the most commonly asked questions about acid reflux and hiatal hernias. We'll cover symptoms, problems associated with the condition, as well as a little bit about common tests to understand what's going on. This video will just cover the basics. For a more in-depth discussion on how these problems are managed, please see other videos which are coming soon on medications and minimally invasive anti-reflux surgery. So what are the common symptoms of acid reflux? Well, there's a burning feeling in your chest, also known as heartburn. There's food or sour liquid coming back up into your mouth. That's what we call regurgitation. There's difficulty swallowing, which we call dysphagia. There's a feeling like there's a lump in your throat. That's called globus sensation. And then there's coughing, especially multiple episodes of coughing when you lay down at night, and that doesn't have a fancy name. So what can happen if you have acid reflux for a long time? Well, there's two major problems that commonly arise. Number one is Barrett's esophagus, and this is where the inner lining of your esophagus changes from normal to precancerous. It happens in about 7 out of 100 patients with untreated acid reflux, and it can sometimes turn into cancer if not watched closely, although that's rare. And sometimes it requires additional procedures to treat to get rid of the Barrett's esophagus. It definitely requires surveillance where we need to watch it to make sure it doesn't turn into cancer. The other problem is peptic strictures. So these are like scars that form inside your esophagus from long-term acid damage, and it can make it difficult to swallow because food could get trapped down there. The opening of your esophagus isn't as large as it normally is, and that can cause difficulty swallowing. It can also require multiple procedures where you dilate or stretch open the esophagus with a balloon in order to get it back to the normal size so people can eat normally. So when do doctors check for acid reflux? Nowadays, if you have common symptoms of acid reflux, doctors will prescribe acid-blocking medications called proton pump inhibitors. These stop the creation of acid in the stomach. However, patients don't actually know if they have acid reflux for sure. We're just making a good educated guess. If the patient feels better, we assume that it was from the medications. If the medications aren't working, or if we're not sure that the symptoms are caused by reflux, or if we're considering performing anti-reflux surgery, then we really need to be 100% positive that's what the diagnosis is. And so we need to do some testing before we move on to treatments. So how do we test it? So the first test is called EGD Bravo, or upper endoscopy with Bravo placement. In this test, you get some medications to make you sleepy by the anesthesiologist, and then we use a tiny camera on the end of a flexible tube called an endoscope. We look inside your esophagus and stomach, and then we place a small device called a Bravo capsule to measure how much acid is coming up from your stomach. It's a true story. The name of the Bravo device was invented because Pavarotti, the Italian opera singer, had acid reflux, and they said if he heard about it, he would say, "Bravo!" So that's why they named it the Bravo device. The second test that we run is called high-resolution manometry. And this test looks at how well the muscles in your esophagus are working. It measures the pressure and the movement of the muscles as you swallow. Sometimes these muscles are damaged from acid exposure, and so we need to check that so that we're aware of that, especially if we're planning anti-reflux surgery. And then finally, the third test is called an esophagram. And these tests can be done in any order, but the last test is the esophagram. So you drink a special liquid called barium, and a radiologist takes X-ray pictures to see how the liquid moves through your esophagus. This helps them see if there's any blockages or other issues. It gives us a broad anatomic overview of what's happening. So after all this testing, you will know for sure whether you have acid reflux, how your esophagus and stomach are functioning, and what the anatomy generally looks like, what the inner lining of the esophagus looks like. If you have a hiatal hernia, it can tell us all that information. If you do the Bravo test correctly and it is negative, the good news is that you could stop taking your anti-reflux medications because acid-reducing medications will do you no good. You have a different condition that's causing those symptoms, and then we need to look into what that is. We can look for other problems, and we can stop the medications, and that can actually save you money in the long term because you're not taking medications with side effects for no reason. If the tests are positive, then you can decide whether you want to stay on the medications, try increasing the dose if we have room to increase it, or go for surgery. Either way, having the information goes a long way. We can tackle the problem and help you feel better. If you want to know more about acid reflux, I have more useful info on my website, which is norcalsurge.com. And you can stay tuned for my next video. We're going to talk about different ways to treat GERD. We're going to talk about Barrett's esophagus, hiatal hernias, and I really want to make this pretty detailed for you guys so that you have a great overview before you meet with a doctor or surgeon so you know what to expect. Okay, thank you very much, and I'll see you in the next one.